name's Leann Hooker, and I'm doing a health assessment today for our health assessment class at Winston-Salem State University for the RN-BSN program. Our patient today is Miss Elizabeth Darnell, a 34-year-old female. Miss Darnell, we need your permission today to record this video and show that for learning purposes. Is that okay?
Yes.
Thank you very much. We're going to start today with a basic set of vital signs. We're going to first get your height and weight, if you don't mind sitting up here for me. Okay, and if you'll turn around backwards for me, we'll see how tall you are. Stand up nice and tall, look straight. Okay, you can sit there. 61 and a half. Okay, we're going to go to a room now so we can do a brief assessment. We're going to start out first getting your oxygen level, okay, and we'll also get your temperature. Okay, 98.1. We're at 98%, and your pulse is 92. We're going to get your blood pressure today on your arm. Okay. (94/62). That's perfect. Good. Okay. And now we're going to take your radial pulses. To do that, I'm going to palpate with 3 fingers. Okay, I palpated her radial pulse in 30 seconds at 45 beats. You can multiply that by 2 and get the 90 beats per minute like she had on the pulse oximetry. Her pulse is regular. If it were irregular, we would count that for the full 60 seconds. I'm also going to check this side to make sure it was the same and matched the left radial pulse. Okay, and in that 30 seconds, that one's nice and regular as well. I did not count the rate on that side just because it was regular. But during that 30 seconds, I watched Miss Darnell's respirations, and they were normal and regular as well, 18 per minute. All right, Miss Darnell, we're going to do a brief survey. Okay. First, I want to ask you if you've had any pain since the last time you were here.
No, ma'am, no pain.
Okay, pain can be addressed as a 5th vital sign now. So no pain, so we'll mark that. Do you have any allergies to any medicines?
Sulfa drugs.
Okay. And I see here it looks like it causes GI upset. Is that
yes.
Right? Okay. And any allergies to any foods?
No. Oh, I'm sorry. Yes, I do. Watermelon.
Oh, okay.
It causes itching of the throat.
Wonderful. Thank you. Mm-hmm. All right. And are there any medications that you take on a daily basis?
No.
Perfect. And are there any past medical history that we need to be aware of?
I have ulcerative colitis.
Okay.
And I've had kidney stones.
Perfect. Thank you. Mm-hmm. And how about any surgeries?
Had 1 C-section.
Okay.
And 1 kidney stone removal.
Okay. Any Any difficulty with anesthesia?
Nope. And I've had a colonoscopy.
Perfect. Are your immunizations up to date?
Yes.
Great. What about past family history? Anything we need to be aware of about family history?
Let's see. My dad has hypertension.
Okay.
Mom has anemia, pernicious anemia.
Okay.
Grandmother has hypertension and has had breast and uterine cancer.
Okay.
Grandfather had atrial fibrillation and high blood pressure. And I have an uncle with diabetes, if that matters, type 1 juvenile.
Perfect. Okay. And you're up to date on your physicals, considering the cancer history. Okay. All right. Considering the family history of hypertension and the cardiac disorders, I think we're going to proceed today with a cardiac assessment, if that'll be okay.
Yes, ma'am.
We'll look over the cardiac and peripheral circulation. Now we're going to start out having you lie back for me.
Okay.
Just this head up for you just a little. There you go. Get this out for you. Alright, we're going to start today with the carotid artery. I'm going to palpate that now on your right side here. Again, using the 3 fingers. You want to feel mid-neckline for the carotid artery. You want to make sure that feels nice and regular and strong, and also that there's a good upstroke. We're also going to palpate the left side using 3 fingers. It's very important not to palpate both sides of the carotid at the same time. This could inhibit blood flow to the brain, which wouldn't be a good thing. Okay. Next, we're going to listen to the carotid artery on both sides. I'm going to use the bell of the stethoscope to do that. We're listening for any type of bruit that may be heard, any swishing or whistling sounds. For that, we're going to start at the jawline. Okay, and then move mid-clavicular. And then to the base of the neck. Okay, we're going to do the left side the same. Jawline. Mid-clavicular. And then base of the neck. Again, with auscultation, there's a good upstroke. There's no whistling, no swishing sound that would be indicative of a bruit. So we're going to move to the jugular vein assessment. Ms. Cornell, I'm going to lay you back.
Okay.
And if you will just turn your head to the left for me. Here you can see the pulsation of the jugular vein. When you lay back, it fills, which is a normal sign. As the patient returns to a sitting position, you want to make sure that this jugular vein empties and goes completely flat. You can also palpate the pulse here. And as we sit Ms. Darnell up, this should empty. Okay. And in a sitting position, you can see that the jugular vein goes flat. And again, that's a normal assessment. If you see this distended, you want to worry about congestive heart failure. And also left-sided failure for blood return, meaning the blood is staying above the shoulders and not emptying. Even if it's a sluggish empty, you may want to order an ultrasound. Okay, Ms. Darnell, we're going to move on to the auscultating of the heart. Okay. I'll actually begin with palpating. We're going to start on the right side of the chest, the second intercostal. This is where you can find the aortic area. So we're going to listen here once we palpate. You can actually feel a pulsation there. And you can also go straight across, second intercostal there again. And this is your pulmonic area. So you can palpate and feel the pulse there as well. Next, we'll move down one intercostal. And this will be Erb's point. Erb's point is actually your third, your fourth, and your fifth intercostal area, which can also be referred to as the tricuspid and the mitral area. So we're going to begin with the diaphragm of the stethoscope and listen. We're going to start with the aortic area, which again is second intercostal. Then the pulmonic area. Okay. Down to Erb's point, which is third intercostal. Tricuspid. Okay. Then we're going to hear mitral. The mitral area is actually the apex of the heart. You want to move on next with the bell of the stethoscope. This can give you a different sensation, or maybe allow you to hear murmurs, things like that you want to be concerned with. So again, we'll move to the bell of the stethoscope. You can go backwards as long as you stay in the same sequence, but we're just going to go forward again, starting at the aortic area. The rate and rhythm are very regular. There's no sign or symptom of any murmurs. The lub-dub sound is heard very clearly, which is indicative of your S1 and your S2. That just basically means that the valve function is very good. They're opening and closing when they're supposed to. The rate, again, is about 90, which is indicative of, or matches her radial pulses and her apical pulse that we checked earlier. So I would say the heart sounds are within normal limits. We're going to move down to peripheral circulation. We're going to check both her hands for capillary refill. You want to first touch her hands, make sure they're warm, there's no edema noted. We'll go down to the nail beds, and for capillary refill, you want to press and release on the nail bed. You can note the color discoloration in her nail bed when you press with a quick release, which is less than 3 seconds. If the nail bed does not refill in color within 3 seconds, you want to worry about peripheral circulation. She may have some peripheral artery disease. But those look great. All right, let's take a look at her lower extremities. Again, you want to feel lower extremities for any type of edema. Note any pitting edema over the shin. No edema there. Have you had any swelling in the past, Ms. Jordan? No. Okay. We're going to check popliteal pulses, and to do this, we'll actually have her bend her leg slightly. Take both hands and cusp behind the knee. And you can actually feel a popliteal pulse. Again, you're feeling for regularity and intensity. Check this one. Those are regular. And lastly, we're going to check for pedal pulses. Again, with 3-finger palpitation on the top of her foot. Feet are nice and warm, no edema noted there as well. And pulses are nice, strong, and regular. That's it for our cardiac assessment today. Ms. Darnell, thank you for being my patient today. Everything looks great.
Good.
Thank you.
Thanks.